Hi, everyone. Thanks so much for joining us for the 8th session of our live virtual series called Beyond the Clinic, Living Well with Melanoma. In each session, we explore some of the key challenges facing our melanoma community to learn from each other and to find solutions together. Today's session will focus on the fear and anxiety around treatment decisions. I'm Dr. Raymond Liu, oncologist and director of the Cancer Survivorship Program at Kaiser Permanente, San Francisco. As a reminder for everyone, we want to make this as interactive as possible, so feel free to add to the chat and send us questions that you like answered, and we're looking forward to addressing your questions and comments in our 30 minutes together. Today's special guest is Dr. Jennifer Hay, attending psychologist in the Department of Psychiatry and Behavioral Sciences at Memorial Sloan Kettering Cancer Center, and a professor of psychology at Weill Cornell Medical College. Welcome, Dr. Hay. So glad you could join us today.
Oh, thank you so much. I'm really looking forward to this.
Great. I think we always like to start with an acknowledgement about the topic we're talking about, which is treatment decisions, and how stressful that can be, and especially if there's time pressure and things like that. So want to see how common you hear about this, and what are your thoughts on it?
Oh, well, how commonly do I hear this? I hear this every single day. There are just a myriad of treatment decisions that patients need to make, no matter at what stage of disease they are, what kinds of treatments are available to them. And so this is a topic that I think is sort of an everyday topic that many patients, if not all patients, at some point in their melanoma trajectory are going to face.
Yeah. So what do you think, just starting very broadly, like how do people make decisions? What are the things people should think about when they are making decisions?
Well, there's a substantial literature on decision making in psychology. And for many, many years through the 80s and 90s, there was a real focus on deliberation, which is important, right? So being able to deliberate, think through your options, balance the risks and the benefits of a treatment, and to a treatment or another decision, and to come up with a decision that's very rational, right? So there was a real focus on that in the psychology literature for a number of decades. And more recently, there's been an acknowledgement that there's really also an intuitive piece to this, right? So that, not only do we take into consideration all of the risks, all of the benefits, but we also may have a real feeling for what is an ideal decision for us. And when you think about most of the major decisions that we make in life, that are really major, who to marry, where to live, which house to buy, all of those sort of major decisions, certainly they take lots of deliberation, but they also take an intuitive, I know this is right for me, I know this is not right for me, a real emotional piece. And so, I'm really happy that the literature has started to take that into consideration, because it's really true, is that we have to acknowledge both sides of the coin, both the cognitive deliberation, listing of pros and cons that many people do, but also the feeling about which is the best decision for me at this point in time.
And it seems like it would be really individual, right? Because some people might be like a very rational decision maker. Some people might be emotional decision makers, or some people may be contextual. So like in certain types of decisions, they're very emotional, and certain types of decisions are very rational. So it feels like it's a very personal journey in that way too.
Exactly. So there are individual differences in whether people prefer to think more or feel more, or rely on the context. And what I might do with a patient is to encourage them to see the whole package. So if I'm sitting with an intuitive decision maker, I may encourage them to also think more deliberatively. If I'm sitting with a really kind of sort of black and white risk and benefit type of person, I might also encourage them to think about their feelings, right? So looking at the entire package can sometimes help them, get to a better place. But you're right, people do have preferences in how they make decisions. Another element, though, is that some of the decisions that we are making in the clinic are preference sensitive, in that they really are very sensitive to what you want. What are your preferences? What are your values, right? Because we've got two different, let's say, treatments that may have, really the same amount of data behind them, so that it really is in the patient's, court to make that decision. Where there are other decisions, there's a, kind of a really clear, a better decision or less good decision to make.
Yeah, it seems like in a lot of our conversations when I have with patients, there is a lot of gray areas, right? Because even when you dissect out the data, at some point the data only goes so far.
Completely.
And so I love this idea of the values-based conversation, but how does someone get beyond the paralysis of that sometimes? Because in a way, you want the benefit of the treatment, but in a way, the toxicity doesn't sound good either. So you're in the really uncomfortable space where we want a treatment that doesn't have any side effects, but like, what do we do when the treatments have side effects? And what we have is statistics.
Right. I mean, listen, that's not a question that has one answer.
Mm-hmm.
The kinds of things that I might do to help patients get beyond that is to take some time to think about this, even if it's a short period of time, to really, bring this to their family and see what kind of feedback they're getting from family members that they know and trust. Yeah, I mean, often there are treatments with a, kind of a very promising, efficacy, but there's a lot of fear about the toxicities. The other thing that I help them do is to talk through, well, what would happen if they had some of these toxicities, and who would they call, and how could they see that playing out, and how well do they feel that their physician, their hospital context might be able to handle that.
That brings up a good point, which is, I think when you talk about community, family, everyone has a different trusting relationship with people in their lives.
Right.
And I think what you're saying is that is important, to go to the people you trust and to sort of like as a sounding board and to involve them. Yeah.
Absolutely. Sometimes I find that patients are sitting alone with these decisions, and that's not necessary, that they do have people that they can reach out to. And often what family members and close friends can do is to raise questions that the patient then hasn't thought of. And that, reflecting on those questions, bringing those questions back to their oncologist is a good way to start to sort of break through, the decisional paralysis that as you and I both know, can really, exist.
Right. How do you deal with, because like the other thing is, like, some people live in large families, some people have large support networks, and some people have small ones, but sometimes is there a magical number of people where like too many opinions becomes stressful, or have you had anybody tell you, like, what is that magic number?
Oh, totally. There is no magic number. Generally what would happen in a large family is that they prioritize, that, and that, we can help them prioritize. So, which family members they want to hear from early and often, which family members they might want to kind of keep a little bit at a distance and talk to them later. But really, it's less of a problem with the big families as it is with the really small families. When there are very few people that the patient feels that they can, run these, decisions by. Even if it's just one or two people that we can identify, even if it's not a family member, if it's a close friend, it really does help to sort of get out of your own head, and to really sort of field new questions and new perspectives on how this decision might go, that they can then bring back those questions to their oncologist.
And that also goes to, sounds like what you were saying before, which is if someone's logical, to bring in an emotional component to them, because it's just a different perspective, to allow them to see it from a different angle. Correct. And then come up with a decision that feels feels right. And that is right.
Often I find that it's very hard for patients to think of all of the relevant questions themselves. And that's where family and friends can really, really be helpful, in addition to all the other types of support that they can provide.
Right. We have an attendee who has a very interesting question. It's a more medical one, but I think it does tie to some things we're talking about. The question
Yeah.
is really related to what's happening when there's a biopsy and whether the tumors, if they get biopsy, can be inflamed, and that's true. So sometimes after a biopsy, you can get more tenderness or inflammation, and
Yeah.
it feels like growth, but it's not really. But I think that the issues around that is really about like how do patients how do we interpret things that are happening and keep that trust feeling, because a lot of these things require decisions. To do a biopsy, are the biopsy results real? What's happening after the biopsy? Like all these things are coming in at the same time. There might be unintended side effects. There might be a progression, unfortunately. And so how do we, there's so many decision points along the way, so much information coming in. What are some of the strategies to help process all that and get through that?
Yeah. I mean, I think you're touching on an issue that is like a sort of front and central to, anxiety. And the fact that it is very, very normal and very common to be quite anxious in these situations. And, honestly, we have really useful cognitive behavioral strategies to manage anxiety, as well as medications. And so sometimes we've got to take this out of the realm of just making decisions and really help the patient with an underlying anxiety that has come up around these things. And medication and cognitive behavioral therapy, even short term, can be very helpful. Because it's very hard to think clearly when you're anxious. as we all know from, is because anxiety is so common, right?
Well, and also I think part of it is also some of the anxiety. We had a separate session about anxiety, which is like this anxiety about just waiting for scans,
Exactly.
And
right.
so there's a lot of reasons to naturally feel these feelings. What about communicate? Like, how does a patient communicate with their care team and that trusting relationship with the care team? Like, what are the members of the care team you think they should communicate with, and how does that communication work with the doctor from your perspective?
Well, so every care team is different, but I think that patients sometimes are not aware of the full range of the team that they can access. And if they are exclusively or only getting their appointments with their oncologist and talking with them, they may be minimizing how much the larger team, whether it's the nursing team, if there's an APP, nurse practitioner, if there is a social worker that can, who's available, is that the team is usually a lot larger than just the oncologist. It's not necessarily similar at all medical centers, but being able to kind of run your questions by people on the team is really important, because you may have days or weeks before you see your oncologist again. And so I don't know if you're talking about the specific issue of the inflamed biopsy, or I'm also thinking it happens with pseudoprogression. Immunotherapy is that there's a lot of anxiety and discomfort about, well, what is happening? And does the doctor have his or her eye on me well enough, right? Is this, am I getting lost in the system? Am I, am I, not being prioritized? And I think that, sort of what I do is I try to really kind of put the entire team back on the map for them, because it is really, really difficult to feel alone with this, or to feel like you've got to, kind of sit around and wait for your next appointment with your oncologist.
And I think a natural way for many of us these days to get information is through the internet. And I know there's this series of publications happening in our oncology journals looking at misinformation in oncology, and there's a lot of it apparently in this recent report. What do you think about like where people should get that information? Because it might be some time before they can see the doctor. How do they get the information they need to? Because some of the anxiety is just because they don't know, but they want to know.
But they want to know, yeah. Well, I think that there's definitely a place for internet information. I mean, listen, it's very hard in this point in time to say don't go to the internet at all. No one could, live up to that.
Yeah.
But I do think that if we've got patients who are, uncertain and highly anxious, really going to the internet is to their detriment for a number of reasons. First of all, the information they find there, as you say, it may or may not be accurate. It may or may not be up to the minute, updated. It may be, a little bit outdated. And the third reason is it's not personalized. It doesn't,
Right.
it doesn't reflect their specific medical situation. And so what I generally do when people are anxious and going onto the internet and finding, horror stories or, lots of information that they can't really, they can't really vet it. I ask them to reflect on what are the reasons that what are they looking for? Exactly what are they looking for? And can we get those questions down on paper so that they're ready for the medical team, whether it's your nurse, whether it's your next appointment with your oncologist, and to really acknowledge that these are specific questions that you need and deserve to have answered. And the internet is generally not up to the job for those reasons that I outlined there.
Wow, that's so cool, because I think you brought it back to a values discussion, because it's not personalized, right? So it's about your values and why you want the information, not just what the information is, and then making sure you can, whatever it is, journal or keep it together, and then bring it to that team that you do have a trusting relationship with, and then have them help answer some of those things.
You'd be surprised at how often I'll hear patients say, I wish I knew about this, or I wish I had more information about that. And I feel like it seems obvious, but it is really important to encourage them to get those questions down on paper, so that in their next meeting with the medical team, they can ask those questions. I think that sometimes appointments go by very quickly. There's a lot of, information conveyed, and they leave the appointment and they haven't asked all their questions. And, just being able to get them down on paper and get them answered is very calming and very centering, I think.
Yeah, that's great. Keith, thank you so much for the comment. He's asking, what role do the oncologists play in proactively helping patients and caregivers minimize the anxiety level, like in the waiting periods? And I would love to know your perspective. My perspective as an oncologist is that we have a lot of role to play, but again, it goes back to our whole team. Our whole team has a role to play to help reduce that, because it's whether it's an earlier appointment or it's answering the question in another way, or it's getting the right team member to answer the right question. I think the entire team has a role and responsibility in working with them. And it sounds like to me, again, that we're talking about, it's that building that trust relationship is so important.
Right.
And then once you build that trust relationship, then the processes can move forward.
Yeah, I think trust is so important, because there are questions that I think patients are reluctant to ask because they are worried that they're going to sound uninformed or uneducated. So having trust that there's mutual respect there is important in, them getting all their questions out. But I think often patients are just hyper aware of how busy we all are. And in particular, how busy their oncologists are, so the fellow comes in, there's a certain amount of the appointment that's with the fellow, then the attending comes in, there's a certain amount of time with, and that, so much information can be conveyed that I think one thing that oncologists could do to improve this is to just give a minute at the end of the session and say, what other questions do you have? I think that many, if not most, oncologists actually do that, but there are those additional barriers around trust that I make that, a little bit difficult.
Yeah, and I hope the oncologists are watching this too, because, I think there's something for us to learn as physicians as well. And, one of the things I do, and everyone has their different style, but I flip it when I visit. I don't ask it at the end, I ask in the beginning. Yeah. Because what I feel like is, if I start the visit with my agenda, and in the back of the mind, the patient has a different agenda, they're worried about something, they're not going to hear what I have to say, because they need their question answered first.
Yeah.
And so I think works very well for me, at least, is I ask first, how are you doing? what questions do you have for the visit?
Right.
Of course, I have things I want to talk about, but let me know what's on your mind. And I think that can help the visit go better too, and reduce the anxiety.
Absolutely.
Yeah.
I think that makes complete sense. And I bet that's very well received.
Yeah, it is generally. We have so many great questions. We have someone, thank you, Jim. So like, what's the resource? This is another resource question. Like, how do we find information about, in this case, a lytic lesion, a metastatic spine lesion? And it's a very nuanced question because it's like everything else is fine, but it's an isolated lesion. And, you know, again, I'll get your take on it. My take is, you know, those things that are so personalized are hard to get on the internet again, or other sources of information. That is exactly something that your care team and specifically, I think this one in case with oncologists should talk to you about and really sit down and have a discussion and to feel comfortable being able to ask that question and to find out like what are the things that are important around that question, like why is that question important and what does it mean to you? Yeah.
Exactly. I completely agree. No, you know, it's very hard when, you know, when you hear that kind of news and then you're home and you want to learn more, you know, and, you know, I think that there's some impatience and sort of just wanting to kind of fill the gap. But, you know, again, we don't want to fill the gap with information that is outdated, not, you know, not relevant to you, and maybe inaccurate, which is, you know, often what's on the internet.
And there might be like multiple questions you can ask, and it's not clear like what is the right question, right? Is the right question, is it real? Is the question, are we going to biopsy it? Is the question, how are we going to treat it? Is the question, you know, do I have pain there? I mean, there could be a lot of different questions and so personal to this specific case, in which case the internet can't help you answer that, unfortunately.
Right, exactly. It's really you know, unpacking a series of questions along the lines of what you just said, and all of them are very important.
Right. John, thank you so much for your question. So the question is, how do you handle the surgery versus chemotherapy question? Oh boy, these are getting really, really great. There's usually fear associated with both. No one really knows what ultimately is best. So it's not just about different types of, you know, this immunotherapy or that immunotherapy. It's something so different, right? Getting operated on versus a systemic treatment. Wow. Yeah.
I mean, I'm not sure even where to start with that. You know, that's really, I mean, that's really difficult. And I think that, you know, it's, you know, some of it depends on sort of, well, what are the potential outcomes either way? And can you get a meeting with your surgeon and your oncologist to talk that through with you? That might be possible. You know, but these things are so incredibly difficult, and you're going to want to know, well, what are the short-term potential side effects and complications, and what are the, you know, the longer term, side effects that are potential, as well as like, you know, what are the benefits either way as well.
Right.
You know, and some people, you know, just prefer surgery first.
Mm-hmm,
you know, the sort of like, let's just get this out. You know.
And that's a value. Again, we're going back to the values issue, which is like different people would make different decisions given the same information.
Right.
So it would be nice if there was, in some facilities, like we do a multidisciplinary practice in our institution where, you know, you have medical oncologists and surgeons working together. And sometimes we even meet with the patients together, but that's not the case in every system. And so it's really about the patient weighing their own values and looking at the risks and benefits, but making sure they ask those questions that reflect their own values.
Exactly.
In the risk and benefit discussion. Yeah, I think we deal with that a lot in the prostate cancer world as well, where there's a surgery versus, and it's not clear which one's better, but they have different side effects.
Yeah, absolutely.
It's really hard because in the end, people choose different things based on that.
Right. You know, and I think the other thing that we haven't talked about yet is that, you know, the patients sometimes prefer to rely on their doctor's opinion, maybe more than we would like, because we're asking patients to make their own personal decisions based on their values. But then they turn around to their doctor and say, well, what would you do? Or what do you recommend? And I think that that's, you know, that's difficult, but I just want to acknowledge that happens all the time. And it, you know, there's a, you know, there is an important place for, you know, physician opinion.
Yeah, no, I think that's a great point, which is,
Yeah.
we had talked about it before where, in the prior world, it's like, always just listen to the doctor. Now it's like, we don't do that. Doctors don't do that anymore.
Try
They're like,
not
what
to
do you
do that.
want? And then
No.
sometimes it's paralyzing because you're like, then we get that where it's like, well, but you're the doctor. So, my approach has been more, I want you to be in control of things. We'll always support you. This is
Right.
a potential recommendation based on what I heard your values are. Again, going back to that value decision.
Right, exactly. So
Yeah.
you're reflecting back to what their values are and letting them know that you heard them, that you heard them, and you see them as the individual that they are. And so it's not like you're making a decision based on your own values per se, that you actually heard your patient, and what where he or she is coming from.
And that seems to be the common theme. I know we're almost at time, but it's like your values, know who you are, acknowledge that this is a hard, and then making sure you can create a trust with your care team and communicate that in a meaningful way.
Exactly.
I think you had also, I wanted to just mention, you had some resources you thought you could, people could go to if they had other questions. Do you want to talk a little bit?
Yeah. Do you want me to
just name them out, and we can put them on the website later, maybe. Yeah.
Okay, so a great one is the Smith Center for Healing and the Arts. And it sounds like it doesn't have anything to do with cancer, but it's completely, a cancer support system with counseling, retreats, groups, resources online. It's wonderful. Another one is Cancer Care. Also lots of resources, free counseling, support groups online. All of these resources are online and also in person. And then the National Cancer Institute has lots of great information about survivorship and the treatment trajectory. And so navigating through the National Cancer Institute website can also be really useful in finding resources and information. And certainly all the information on the NCI website is vetted and accurate and up to date.
That's fantastic. And we'll definitely put those on the website for folks that are interested. I know there's 2 more questions out there. We can't fully answer them. They're really about how do you build that trusting relationship? And I would say, especially if you don't feel like there is one. And I would say, from my perspective, it's about being open. Most of us go into oncology because we value that really close connection we have with people in that room, that it's so important, that physical human connection. And sometimes there's just a barrier feeling, well, what if I let my oncologist know my fear and anxiety? But I think we want to hear that, and the whole team is there to support you. And there is a value if you feel like you're not being heard, to ask the team, other members of the team, even, like, how do I, to just be open and say, how do I build that trust? Because maybe it's just about building trust first before you can even get to the question. Right.
I'm so glad that you said that. And I think sometimes patients are afraid to do that because they want to be liked by their care team, and they don't want to bring up any concern they have about communication or lack of trust. And it's so important to just sort of wade into that, and to bring that up if something's happened that hasn't felt right, to bring it up to the medical team, to get back on track, because it is so important that you trust your team and your doctors. And as you're saying, it's that they went into this because they wanted to help people in some of the most profound ways. And so I hope that patients give their medical teams a chance in that way if they're not feeling trusting.
Thank you, Dr. Hay. Thank you so much. I mean, we had so many amazing questions. Thank you in the audience for sending those in. And I know we could spend hours more talking about this and dissecting things out. I know these half an hour things are so brief, but I'm so grateful for the time you spent with us today.
Well, it is very brief, but I feel so thrilled that AIM at Melanoma has brought this to the forefront. And as we know, sort of making decisions and being in the right mindset, it makes all the difference in going through these difficult things.
Great. So thank you, everyone. Come join us for our next session. We're going to be meeting with Dr. Jamie Jacobs. She's an assistant professor at Harvard Medical School, and the Director of Caregiving Research at Mass General Hospital, and we'll be talking about how to care for our caregivers. Also another very interesting,
that's great.
important topic. So hopefully looking forward to seeing everyone back shortly, next month.
Great.
Okay, thank you so much.
Take care. Thank you so much.
All right, bye-bye.